Good health and welcome to today's edition of Ethnic Health America. I'm your host, Dr. Mike Lenore. Today's program is on the legends in medicine. We'll meet three special doctors, each of which has journeyed through episodes of discrimination and prejudice to the heights of his profession. Stay tuned. We'll be right back after this break.
Hair loss. Now this rash on my face, what's going on?
For answers, ask your doctor the right question.
Could I have lupus?
Welcome back to Ethnic Health America. In this segment, we're talking with retired orthopedist Dr. Walter Morris. Dr. Morris practiced in the Bay Area for a number of years. Let's talk to him about his journey through medicine. Dr. Morris, welcome to our program.
Thank you.
Tell us a little bit about your background, where you're from, and how you got interested in medicine.
I was born in Mobile, Alabama, 1921. At that time, education opportunities weren't very good for us in that area, and my father had the foresight to try to get the best for us. And through the efforts of a great man who came to our area, who was a graduate of Howard, we called him Dean Moss, my family was given an avenue to go to Massachusetts, where we were able to go to school, and we grew up in that area. Having no idea where this might lead to, he wanted us to have the best. And in an early age, I had an interest in medicine, having seen one of our role models in the area. On a particular occasion, I assisted him, and I saw the benefits that he gave to this individual, and I wanted to do the same. So that's how I became interested in medicine.
Now, where'd you go to college?
I went to, first had the opportunity to go to Tuskegee before 1941. In fact, I was in Tuskegee on Pearl Harbor Day. I was in Tuskegee.
And you had a chance to work with a great man there.
I had the opportunity to see Dr. Carver. As a student there, I was had the opportunity to be a guide on the campus, and I took many visitors to his laboratory.
George Washington Carver.
Saw Dr. Carver himself.
Now, when you finished your education, undergraduate education, how hard was it for you to go to medical schools? There weren't that many medical schools taking African Americans.
We had, at that time, Howard and Meharry as our schools that prepared 100% of the Afro-Americans for medicine. And it was a great opportunity to be able to be selected to go to one of those schools.
People don't realize in those days that that there were so many black applicants for those very few places.
Many. I think I was told that 3,000 applicants was for each school, even more.
Now, how did you get out to California, and how did you get interested in orthopedics?
While in my internship at what was then the old Gallinger Hospital, D.C. General now, we were the first Afro-American interns, and I had the opportunity to see many of the different kind of areas, and somehow I felt I wanted to be in general surgery, and I had an opportunity to be admitted to the general surgical program as a resident in the Howard University system. And while there, I met Dr. Gladden, and my interest in orthopedics was due to his influence and the others, and I became one of his orthopedic residents.
Now, when you came to California, everybody always considers California kind of the bellwether state, as opportunities are so equal. What kind of barriers did you encounter when you wanted to practice in this area?
when we came to this area, there were limited hospital opportunities. You had to have hospital in California. There was, should I say, the gentleman's type agreement. And through the efforts of great pioneers like Dr. Young, who had made a name for himself at Herrick Hospital. Herrick Hospital became a focal point for many of us who wanted to practice in this area. So and we had hospital privileges at that point.
So there weren't 4 or 5 hospitals you could go to as an African American?
I could tell some stories about some of the hospitals in this area.
One quick one.
Well, we had some of our best trained surgeons and who made applications to what we refer to the Pill Hill hospitals and to
well, people don't know that's one of the big hospital complexes.
The great hospital in the Oakland area, and at what is now the Alta Bates hospital system, they were reluctant to have our people have full privileges, and they were under scrutiny and close supervision when they tried to do their work in those days.
And did you have trouble as an orthopedist getting privileges to these hospitals, doing what you need to do?
Well, through the efforts of some of the orthopedists, and I will name them in particular, Dr. Barber, who was a person up in Berkeley, and Dr. G.B. Lewis, who did much behind the scene to make it possible for me to be able to practice medicine in this area, and to them I owe a great debt of gratitude.
Now, were you accepted by the nurses and the hospital staff? And
the nurses as a whole were the most generous and respectable people toward what we would call the newcomers. They did everything in their power to make us succeed. And I cannot forget those nurses who were at Herrick and Alta Bates and on the Pill Hill, who made it possible for the Afro-American physician to give good care to his patients and all of those who came in under their care.
What would you say to young African Americans who are going into health medicine now about who tend to forget the struggle? What would you say to them about their responsibility in medicine now?
We still have a responsibility to the minority community. We have a disparity between what they receive and what the general population receive. We have a decrease in the number of providers. We have a great loss of our people having lesser facilities, less money. Even though we have the greatest health system in the world, we have many of our people who are not receiving that. And some live within the shadows of these great institutions, cannot go in the doors because they don't have the finances to be able to receive that care. So this is a problem.
So their responsibility is to pick up the pieces. Dr. Walter Morris, I want to thank you for joining us, and thank you for all you've done to make it easy for me
Thank you.
to come into a community like this and practice. We'll be right back after this break.